Hi, this is Pat McDonald, your host for Vote for Vermont, where our tagline is Listening Beyond the Soundbites. Joining me today is Lauren Hebert, who is the Director of Office of Professional Regulations. I don't even know why I'm looking, because in the legislature we all knew the OPR bill, and we'll talk about that in a minute. Welcome to the show.
Thank you so much for having me.
Yes.
It's really a pleasure to be here.
Yeah, nice to see you again.
Yes.
Lauren and I were on WDEV together about
A month ago?
So if we mess this up, Lauren, it's our own fault. Because this is Lauren Hebert 2.
Well, thank you for the opportunity to talk to you again.
This is great because our audience is much different than the WDEV, and I think that this thing is so interesting to me that's why I asked you back on, because it's something people should know about. But first, we're going to spend a little time talking about OPR and a little bit about you. Could you tell us a little bit about your background and how you wound up getting to OPR?
Sure.
And where you are. I didn't even mention the bigger picture here. Jim, he's going to kill me.
Sure. So I am Lauren Hebert. I grew up in Vermont and practiced law for a while in New York City as a defense attorney, and then moved back home and started working at the Office of Professional Regulation, which is embedded in the Office of the Vermont Secretary of State with Jim Condos, who's the Secretary of State, and ended up just loving it there. And I've stayed there now. I'm on my 11th year working at the Office of Professional Regulation. I've been the director of OPR for 3 years, 3.5 years now.
That's great. Well, seriously, because every year you submit this monstrous bill to House. It starts in House Gov Ops, and when I was in the legislature, that's where I was stationed, and it was like, oh, the OPR bill, because it does take a while. You have to dedicate at least a couple of weeks to that bill because it's very detailed. So when we get into that, why don't you tell me what we do at OPR?
Sure. So the Office of Professional Regulation regulates, we're at 50 professions now. It's a very diverse group of professions. We have a staff of 39 and we regulate 50 professions. And really, the professions are very diverse. Of course, we're here to talk about nursing today, but it can be anything. And everyone in the world comes in contact with an OPR licensee. So, when you're buying a home, you're talking with a real estate broker and a real estate appraiser. When you're getting a tattoo, maybe you wouldn't get a tattoo, but
maybe not.
But when one does get a tattoo, you're speaking to a licensee of OPR. Absolutely. When you cut your hair, when you're going to the dentist, when you're receiving most medical care, you're speaking to an OPR licensee. So it's really a lot of facets of people's lives, OPR.
And I think it's important. People want to be licensed, at least from what I remember. There were a lot of associations and stuff that appeal to OPR to be licensed because it helps for recognition and for a good rapport with the customer. And I'm sure it helps with insurance. I'm just deciding that's probably a benefit.
That absolutely is a benefit. But really what OPR does is set the standard for what it means to be qualified as that professional, to ensure that that person is qualified through training or education or an exam, usually a combination of those things. And then once we license somebody, we ensure that a standard of care is maintained. So if somebody deviates from the standard of care and commits unprofessional conduct, then we have a team of people that investigate that incident and then prosecute that incident and would restrict or limit that person's ability to practice. So OPR really at its core is a public protection agency because fundamentally when you're seeing someone who has a license, you have to trust them frequently with sensitive information, and you have to ensure that we have to as a state ensure that they're conducting that responsibility in the appropriate way.
That's great. I think now the only thing you don't do is medical physicians, and that's under Department of Health, which to me makes sense. I think on one hand you wish they were all under one roof, but because it's under the health department. And David Hurley.
I think there's some benefit to them being in the Department of Health. I think there'd be benefit to them being with us too. We have there's two different types of physicians. There's allopathic and there's osteopathic physicians. we have the osteopathic and the medical board has the allopathic. And we have a close relationship with the Department of Health because of the wide variety. You know, we regulate OTs and PTs and nurses and osteopaths and naturopaths and hearing aid dispensers and audiologists and speech language pathologists. So there's quite a few dentists are a big area where we overlap with the Department of Health and pharmacists.
Not to get off onto, because we really do want to talk about the nursing contract, but physicians are expanding not just within the health department, but they're incorporating yoga and incorporating the whole health, the health of the whole body. I know we did a lot of shows here on drug addiction, and the doctors that were on were talking about how they are expanding. So there must be a real tie-in with what David does and with what you do, because they kind of overlap these days.
Correct. I mean, I think a lot of healthcare practitioners are looking beyond Western medicine and looking at supportive treatments, and we do license acupuncturists and chiropractors at OPR. Which those modalities are getting incorporated into other professions quite a bit more.
I was glad to hear that, because that made sense to me that they're looking at the whole person, not just, you know, the elbow. They're really looking at a lot more beyond the one medical issue. Makes sense. Anyway, we are actually here to talk about Act 64, which was started in the Senate last session on S48, which is the Multi-State Nursing Licensure Compact, the cost and benefits for Vermont. And I asked Lauren here because she was very involved, if not instrumental, in working on this compact. And we all know there's shortages of everything, pretty much, but particularly nurses. And I wanted Lauren to provide us some information on this, just because I found it fascinating how it works. So could you provide a little background and history of this compact for us? That'd be great.
Sure. So the compact covers RNs and LPNs, so registered nurses and licensed practical nurses. We have almost 26,000 nurses licensed in the state of Vermont. Now, some of them are living and working in Vermont, and some of them are living in other places and working in Vermont, and some of them are living and working in other places but want to have a Vermont license for some reason. And the compact has been on OPR's radar for a long time. It's been on the Board of Nursing's radar for quite some time. It began in the late 90s as a concept and sort of got formation since that time. Now we are the 35th state that's part of the compact. It is in many of our sister states, so it's in Maine, New Hampshire, Connecticut, not yet in Massachusetts, not yet in New York. And the compact operates very much like a compact always does. And I think one thing that I've come to really realize, and I've educated people around, is there's a lot of compacts in the world. So for instance, the driver's license compact
for sure
means that if you are licensed in Vermont, you can travel to any state and drive without having to get a separate license in each state that you might cross. And that, of course, makes a lot of sense from a mobility standpoint. And this nurse compact is similar. So what it means is that if a nurse is coming from a compact state, they can come into Vermont and start working in Vermont immediately without stopping by my office, without filling out the forms, without talking to OPR staff, and just get right to work in the healthcare facility.
So years ago, and probably still now, we have those things called traveling nurses. So before we were on the compact, did they have to get permission from your office to work?
That is correct.
At Central Vermont or wherever they were going?
That is correct. So they would have to come into our office and apply on paper, and now we're all 100% online. But they would have to come and get a Vermont license. We'd have to verify that they were appropriately licensed in the state where they're coming from. And with the compact, it really is designed to increase mobility and portability so that nurses that are coming into the state have less regulatory friction on starting a new job.
Now, whose salary wins out? Is there some kind of a normalization among the compact, or if we choose to pay more than Maine, whose salary kind of,
Well, it doesn't, the compact doesn't have any effect
okay,
on
so it's the state
salaries.
that you come from.
Yep, the compact really has no effect on salaries or facility negotiation with staff. What it may do long-term is if when facilities, and I know that facilities are really seeking additional staff right now, when facilities are recruiting and trying to find staff, if they're trying to recruit from another state,
Yeah.
they may have to match the other state's salaries to get someone from Massachusetts or Connecticut to come up to Vermont to
Because
work.
I was just thinking of that, they always talked about how expensive the traveling nurses are
Yeah.
compared to, because there's a lot of expenses that have to be covered as well, correct?
There are a lot of expenses, and it's a different payment structure. Certainly, I'm not an expert on traveling nurses, but there's different tax incentives and different
Okay.
payments that have to be made. So it's almost comparing, apples to oranges. But traveling nurses are very expensive, and I know that the Vermont healthcare system wants to reduce the number of travelers that they use. You hear about that all the time. But at this point, Vermont's not growing enough nurses to sustain our need.
But this should really help, I would think.
That
Because
is the intention. I don't think it
yeah.
will solve all of the problems, Pat. I think, but I think it's one tool that we can use.
Because it would seem to me, you mentioned training, that they're all going to be trained on basics, but also any new things that come along, any new equipment, machinery,
Right.
so that when they come from Maine or wherever, I'm picking on Maine because that's where I go for summer, but when they come here, they would be very familiar with the procedures and a little bit more comfortable just moving in here than.
Right, and that's, when we started analyzing the compact, and I'll go back to how we started to feel like we should support the compact. So let me backtrack. So the Board of Nursing had been supportive of the compact for quite some time. And OPR was more skeptical, and we were asked by the legislature to write a report on the costs and benefits of the nurse licensure compact. And we did that faithfully in 2019. We also included in that analysis a survey of all licensed nurses in the state. And what we found was that nurses in the state, and we were able to separate responses by folks who live here, folks who live out of state, by age bracket, by level of training. People were, on whole, supportive of joining the compact. And when we started analyzing the compact, one reason why the compact makes so much sense for nursing is the training and education for nurses is very standardized. There's there's accrediting school. The schools have to be accredited. You have to pass a national exam. Nurses, of course there are exceptions and, people who don't do as well in their nursing program, but nurses are fairly uniformly trained. And then they start to specialize after they graduate. So, which is what I love about nursing. If I could do it all again, and of course I still can, but if I could do it all again, I would go to nursing school.
Interesting.
Because there's so much variety in what you can do, and so many opportunities to build on your skills in the lifetime of your career.
Well, and I think just because I'm old and I remember going to hospitals years ago, nursing was a little more limited back then. And the word bedpan comes. There were some pretty basic things. Now I think nurses are involved in most anything and are truly right-hand people to the physicians.
That's correct.
As opposed to the way it used to be in my day.
It's become more valued as a profession, and more duties and skills are built into their scope, and more duties and skills are also delegated to them from other people. You also can, you start as an LPN and then go back to school while you're working and become a registered nurse. You can then go on and get your BSN in nursing, which of course, every time you get another educational thing, new opportunities open up to you.
And then in doctors' offices, a lot of times you just see
it's the advanced practice nurse, the APRN, and that position, that license in Vermont has a scope that's not equivalent to physicians, but is
close.
very close.
Yep.
And a lot of primary care is done by APRNs. A lot of psych care is done by APRNs. A significant amount of birthing is done by APRNs.
Because they can write prescriptions too, can
Oh,
they
yes,
not?
they have
That's what
they have full prescription
Yeah.
authority. And a lot of anesthesia is done by APRNs.
Oh, that's it, because that is a serious specialty.
Yes.
I don't
yes.
think people realize when they go in for surgery how important the anesthesiologist is. And you better make sure that you talk to them before.
Yeah, no, that's a very
Get
big
to know
responsibility.
that. Yeah, for sure.
But APRNs have really significant training on pharmacology
Yeah.
and the interaction between drugs. So I think it's impressive that career can build that way.
Well, and they've got, this started, my notes say about the year 2000 with 25 states. So they've got quite a few years of experience here. So I'm sure at this point it's pretty compact. I mean, they've got it down pretty much to a science, I would think.
I think they do have a lot of the details ironed out, which was another consideration. And, Vermont is a small state. We don't want to be part of something that's just starting.
Yep.
I think it's prudent to join when something's established.
I agree with you. Sometimes we are out at the bleeding edge, and that drives me crazy because we are a small state, and maybe it's better to let other bigger states make mistakes and
Well,
let
I
us
think we can
jump in
always
later.
learn from those mistakes, and but we also didn't want to be behind. And in the
good point.
licensure world, the nurse compact is becoming fairly standard.
Yeah.
And so we didn't want to be at a disadvantage. And the compact has distinct advantages for particular groups and for the state. So
When you were saying is there a center for this compact? Is there a staff?
Yes.
Where are they located in the
they're in
bigger city?
Chicago. They're part of, they are a subsidiary group of the NCSBN, the National State Licensure Board Association for Nursing.
Oh, okay, so there is, you pick up the phone and go, hello, I have a problem and stuff.
Yeah, they've been very responsive to us. They're very helpful in the questions that came up in the legislative process, and obviously now the bill's adopted and we're in the working process of getting it operationalized. And we've had several questions and long conversations with them about how we
Because I
get
think
this off the
before
ground.
I wanted to go over what's happened since we last talked about this, because this bill has there's a lot to do, so you must be a little busy in your office.
Yeah, we are.
Coming into compliance. So I had in my note that there are several main provisions of the compact, that the requirements for the licensure, and maybe you could just review some of those basic things that are in the compact itself.
Yeah, so there's 11 core requirements to be part of the compact. And compact states, of which Vermont will be one starting in February, will start issuing compact licenses, have the ability to issue a single state license and the multi-state license. And the compact only dictates what's required for folks who are applying for the compact license. And some of them are the same as Vermont's requirements for a single state, graduation from an accredited school, passage of the NCLEX, which is the national exam. But there are some additional barriers. If you are a non-English speaker, you must pass the TOEFL. That's not a requirement in Vermont currently. You can't have any active involvement in a drug or alcohol program related to your license. You cannot be convicted of any felony, and you can't be convicted of a misdemeanor related to the practice of the profession, along with some other.
I kind of like all those.
Yeah, there's some good ones there,
right.
but there's also some reasons to have some flexibility, and particularly when it comes to criminal backgrounds. Vermont has, I think, a really admirable policy position that we believe in rehabilitation.
Yep.
And that we know that people commit crimes, but that's not the defining characteristic of who they are.
Yep.
And also that rehabilitation requires a stable job.
Yes, and to turn your life around, you need that stability for
Right.
sure. Right.
And licensed professions, on whole, with exceptions, have a higher salary than other jobs in the world. And so we don't want to preclude people
Right.
from getting training, education, and then getting a professional license just because
Right,
they made a mistake at some
Yep.
point in their life.
Right.
So
I like that approach.
thank you.
Yeah, that's a good one.
We actually just instituted something in the 2020 legislation, which was called the second chance determination, which means that someone who has a criminal background, who's trying to figure out, what's my future look like? What is
Right,
available to
right.
me? Can put in an application with the Office of Professional Regulation for $25 and say, you know what, I think I want to be an LPN. Let's just stick
Right,
with nursing
right.
because we're talking about nursing. I want to be an LPN, but this is my conviction. I was convicted of a DWI 1.
Right.
Is that going to preclude me from being an LPN? And they can get a determination on whether that
Oh,
would be
perfect.
a preclusion even before they go to school.
Right.
So before they incur any student debt, before they spend the time studying.
Excellent. I like that. That's great.
Yeah, we've had quite a few requests since it went live in
Yeah.
our system, and I think it's a service that
Well,
we
I
can
know
give.
on job applications, they can't ask any more.
Right, the ban the box on job
Yeah, right,
applications.
right.
Yeah, because that doesn't apply to us because of back to the beginning of our conversation, the enhanced trust and stamp of approval
Right.
that the state of Vermont is putting on somebody.
Yeah.
We do want to know about people's criminal backgrounds, but we also license a lot of people
Yeah.
with criminal backgrounds.
Well, in your example, I mean, one DWI, I was almost going to say there, but by the grace of God, but it wasn't me ever.
Well, I
But
think,
it could be.
Right.
It doesn't take much.
no, and I think there's continuing to be discussion about, the impacts of a criminal conviction on
Right.
somebody's life and all different facets.
Yeah.
But we take into account the length of time since your conviction and
What you've been doing.
what you've
Yeah.
been doing,
Right.
and for the DWI example, are you in AA or are you in another support group?
Right.
All of those factors
Yeah.
we take into account,
Well,
and we really do want to.
Speaking of all of that, would be how is discipline handled? Because is it the state where it occurs? Like if you're from Texas and you're here in central Vermont.
I'm going to take a
and-
sip of
Yes,
water for
please,
that
go right
question.
ahead. And who, if some complaint is made, who deals with it? Does Texas deal with it, or do we deal with it?
Yeah. So discipline is a core and very important function of OPR. And how this would be handled is if somebody came to Vermont on a compact license from Texas and committed unprofessional conduct in Vermont, Vermont could take action. We could suspend that person's ability to practice in Vermont. We would also notify Texas, and Texas would have the ability to discipline the compact license itself.
Okay, so it's almost a double
Right.
whammy. So
But the equivalent of that is happening now in a very complicated way. So right now, if Texas takes disciplinary action against a Texas nurse because of something that happens there, and they're practicing in Vermont, we get notification, and then we take action on their ability to practice in Vermont. So in some ways, the compact adds complexity, and in other ways, it simplifies the disciplinary process. One thing that I do like about the compact is of course, our world is supported by IT, right? So there's an IT
Right.
system that all the compacts are part of, and there's a lot more information in that IT system than what we have currently. So if there is a significant investigation happening in Vermont, say a drug diversion
Yeah.
at one of our institutions, which happens unfortunately, we would put that into our system, and other states who are part of the compact would be notified that we're engaging in a significant investigation of this nurse. And that's a piece of information that right now we don't have from sister
Well,
states.
that's important to have. Who's the we when you say that we would be investigating? Would the hospital bring, put up the flag? Is that to you, and then your office investigates in cooperation with the hospital, I'm assuming?
Yeah.
But so how does that work? Who's
So we have a complaint process. We have an online complaint portal. Someone could make a complaint about any of our licensees through that system. But the hospitals have a mandatory reporting statute in Vermont that if there's unprofessional conduct that happens in a facility where they limit or restrict somebody's ability to practice in their facility, they have to notify us.
Oh, okay.
And then we have an investigative team of investigators. Some are law enforcement, some are not. We have 5 law enforcement and 3 civil investigators, and they investigate allegations of unprofessional conduct. Some of those allegations are criminal in nature, and so the investigation is criminal and regulatory simultaneously at the same time. And then that investigation is completed by, gathering all the documents, speaking to witnesses. The hospitals are good partners with us on those investigations. And then that whole investigation is referred to the prosecutors, who also are employed by OPR. We have 4 prosecutors. And the prosecutors review that case frequently with a board member to give their subject matter expertise. And then the prosecutors would bring a case in front of the board or an administrative law officer.
Goodness.
Yeah.
There you
We
go.
run a
That's
little
thorough.
Yeah, we run a little court system within OPR.
Well, with your background, that's perfect for you.
That's where I began at OPR, is as a prosecutor at OPR.
Okay. Excellent. So this law says that it's all going to be up and running February 1st, 2022. So what have you been doing lately?
Nothing really,
nothing,
just admiring the leaves.
Yes.
No, it's been a busy time. We're very fortunate. We have an executive officer for nursing who's really been quarterbacking the whole effort with variety of staff, and it really impacts a lot of areas of our office. Obviously, our IT system.
Right.
We have to integrate with VCIC because
Criminal records.
Yep, with this law is a requirement that everyone is FBI criminally background checked, which is a new requirement for nurses in the state of Vermont.
That's interesting. We never ran background checks on them?
That is correct. We were one of 4 states that did not run.
Don't know that I want to know that. Sorry.
We'll
move on with that.
No, it's okay.
Seriously.
I think this is a good policy direction that we're going, but
I would say so.
But it is a fingerprint-supported background check, which is, a lot of logistics and coordination.
Right.
For those folks who live and work in Vermont, have never been criminally background checked, there's going to be a lot of effort to focus on how do we get these people criminally background checked in an appropriate, streamlined way.
I guess when we were doing all the effort for schools and anybody that works or deals with schools, not just the teachers, but everybody, in my mind, I just assumed that leapfrogged to nurses and doctors so I apologize if I've offended anybody, but I just assumed that that was just be par for the course.
To be clear, and for anyone who's equally aghast out there.
Sorry. Just a little aghast.
We do ask people if they have a criminal background, but of course people lie to us.
Yes.
But we do ask, and we ask somebody to tell us about their criminal background, under the pains of perjury, and we do prosecute people if they've lied to us, and we do have a few instances of that. But I think criminal background checks is a good safeguard, and we were only one of 4 states in the nation that didn't. So I feel good moving forward with this policy, particularly, hand in hand with what I know is Vermont's policy to not just disregard someone or not issue someone a license if a criminal background pops up.
Right.
So I feel like we will be in the best position with the criminally background, fingerprint-supported background
That's
checks, because we can issue licenses if we think the person has rehabilitated themselves. So
yeah.
those
So
two
that
policies,
balances it
hand in
out.
hand, I think
Yeah.
really do protect the
good.
public in a further way.
With all, there's so many the people that ask for the single state, it's, is because they don't have any interest in traveling. Is there a benefit or a negative side to being just a single, just saying, I just want to stay here in Vermont? Is there anything?
I don't think
Or
so.
they're both the same, it's just you get to travel and you don't get to travel?
I think that is the key differential. We'll see. It will be really interesting to see how many apply for the multi-state and how many want to remain with a single state.
Right.
It may become something that is preferred by employers, particularly our employers on the sides of the state. So the powerful thing about the compact and a benefit that we haven't talked about yet is telehealth.
Yes, I wanted
Because
to talk about that for sure.
because the requirement is you're licensed where the patient is.
Yep.
And so if you're doing follow-up on a surgery that happened at Dartmouth, and the patient lives in Vermont or vice versa,
Right.
the UVM and the patient lives in New York, then those nurses need to be licensed where the patient is located, not where they work. So in the UVM example, the provider would need to be licensed in New York
Oh, I
or
see.
in New
Oh, I see.
Hampshire.
I'm sorry.
When the person
Right.
comes from New Hampshire to get surgery at UVM, then that person would need to be licensed in New Hampshire. So
And the benefit for that, just, I'm thinking of why, but I just want to make sure I'm on the right track here. What is the benefit of that they're in your backyard and know the rules and regs of
Yeah.
your state?
it's so that patients can easily make a complaint about the people
Okay.
that provide services to
Right.
them in their states.
Yeah. Well, I love telemedicine. I had only one, then my doctor actually moved back to his home state, but I had one teleconference with the doctor, and don't get offended, people, but I found that he really listened to me.
Yeah.
Because it's his face and my face, and we were talking, and it was not that they don't pay attention to you, but they're usually busy typing,
Right.
and it was so there that I felt really good about it, and
Yeah.
I liked it, and I would be very willing to do more, because they can't look at me and talk to me and type at the same time, so.
Yeah, I think you're not alone. There's a lot of benefits
Yeah.
to telehealth, and there's a lot of benefits to the provider community as well for
Yeah.
telehealth. And I think, the Office of Professional Regulation right now is responsible for an interstate telehealth work group, and we're gathering a lot of perspectives on telehealth and trying to formulate a recommendation to the legislature around how we could codify the ability to do
great.
telehealth more.
Well, I know here in this area, Central Vermont Home Health and Hospice, and I'm sure all of the VNAs, they've been doing telehealth for blood pressure and sugar. I mean, things like that, where every morning you check, see how you are, and that's worked great for years.
I think often it provides more access to providers for
Right.
patients,
Right.
and a different view of patients for providers. And we're definitely
That's interesting that you said that. Could you, I'm sorry to mean to interrupt you, but why did you say it provides?
Well, I've heard, anecdotally, I haven't done any, analysis of this,
right.
but anecdotally that it's really great for kids because providers can see in kids' homes
okay.
and see what's happening
behind
see behind the curtain. I've heard it's great for mental health providers because people feel more relaxed in their own environment
yep.
than going out into the world and going into an unfamiliar place. So I think there can be a lot of benefits on both
excellent.
sides of the equation.
Oh, now I understand. That's excellent. I agree.
Yeah.
Oh, interesting.
And it also reduces barriers for access because assuming that you have an audio or visual connection, you can, you don't have to drive for an hour if you live in central Vermont, to go up to the UVM Health Network
Yep.
and take time off of work. You can sort of integrate your care into your day-to-day life. And I think providers are finding that more patients are coming to appointments that way.
That's great. Yeah, I'd raise my hand for another face-to-face because I just found it more comfortable talking to the doctor that way than in his own office? That was a
So I
little
think that's
weird.
that's exactly what I was referring to. With patients are finding that
Yes.
they're getting a more authentic version of.
Yeah.
I mean, providers are finding that they're getting a more authentic view of their patients.
Interesting. I like that. So we should bring this up because I was always, when I worked in state government, very involved with the VSEA, unions and collective bargaining. How does that work? Most nurses, at least certainly at UVM, are in unions. How?
That is
And
correct.
I'm assuming it's all over. How does that work about
Well,
and it's particularly bargaining?
I think the nurses' unions did have concerns about the nurse compact.
I bet.
There was significant testimony around their concerns. You know, I think the concern always comes back to travelers. I certainly can't speak to unions, but I think the concern is that facilities will hire travelers and that this bill makes it easier for travelers to come into the state. And, you know, we really fleshed that out in front of the legislature. I think a lot of the union's concerns are related to wage and those bargaining units. The compact really doesn't have any impact on wages in the state of Vermont. It doesn't affect the bargaining between the unions and the facilities. What it does do is allow for people who are not currently licensed in Vermont to come in. And so that's where the issue or concern about travelers
So
comes
does
up.
this hospital here, I keep pointing to Central Vermont, but do they pay the compact and then the compact pays the nurses? Or do they pay the nurse directly? For
They pay the nurse
whatever
directly.
his or her, I should mention, a lot of male nurses these days, so the stereotype
Yeah,
of,
the stereotype is changing.
gone. Yeah.
Yeah, which is wonderful.
Yeah, it is. It's great.
No, this only affects the licensure of the nurse. It does not affect the payment of the nurse. And so when somebody hires a nurse who has a compact license in another state, they're paying the nurse directly. The compact doesn't get in between any payment.
Yeah. Now I keep mentioning the hospital, but it's actually nursing homes, hospice care, home care. I mean, it's the whole gamut. So, and I think that's where the home care part, from what I understand there's some shortages there. There's shortages everywhere in the nursing homes, right? So this would help everybody.
I think it will help. I don't think it's the full solution. I think, we need more people to go to nursing school. We need to keep more nurses in the state when they graduate from nursing school. We need every trick in the toolbox, every tool in the toolbox we need to incentivize people to go to nursing school and to stay in the state of Vermont.
Well, I would think nurses here would be very supportive of this, because if there's not enough help on the floor, they get to work double duty.
Right.
I mean, somebody's got to do the work, so it falls on them.
Most nurses in the state are feeling stretched very thin right now, particularly with COVID and staffing, and it's undeniable that we need more staff.
Is there any plan to advertise about the compact and to use it as a recruitment tool, come and see the world?
I'm hoping that we do that. That's sort of on my roadmap. I haven't done the work you're asking me before I've started, but it's
I'm sorry.
It's okay.
But it's a good idea to think about.
It is a good idea to think about. So, ACCD has some efforts to, I think it's their Think Vermont webpage. They try and encourage people to come here. And I need to reach out to them and say, you should really put this on your webpage. We also have something called Fast Track Endorsement, which is relatively new as well, which means if you're licensed in another state for 3 years, not just in nursing, in anything, you're an engineer, you're a dentist, you're a mental health provider, you can come to Vermont and get a license with just verification from that other state. So it really is intended to increase people moving and staying in Vermont, that fast track endorsement.
And what happens if they want to go to, as you were referencing before, some of the more advanced levels of nursing, which I think is just so exciting.
It is. Yeah.
I mean, if you really have a serious career,
Right.
you could move right up the ladder, get very close to being a physician if that's what you wanted. It wouldn't take too much to make that leap.
Right.
So what happens, they can stay in the compact, but can also then pursue other
Right.
licensures?
So the APRN license is a credential that stacks on top of the RN license. So the RN license would stay a compact license, and then that APRN would have to have a compact license plus the APRN license in Vermont. And if he or she wanted to travel to another state, they'd have to get the APRN license in the other state.
Oh, I see. Oh, so there's not a compact that covers that.
There is an APRN compact. It's at the very beginning of its work passing through
right.
states. I think there's 6.
Oh, cool. So what, I'm just bouncing around because all these things are coming to mind. We talked a little bit about, do they have to cover their own working conditions, not working conditions, living conditions? Like if somebody came here from Texas, do we find them a place to stay, or do we give them money to cover that? Because that could, depending on where you go, that could put a dent in your pocket.
Yeah. So that depends on if you're a traveling nurse working for an agency and coming for just a quick visit, or whether you're coming from Texas and you decide, there's an OR position, an OR nurse position, and you decide to apply. You come from Texas and your intent is to stay. That would be the difference.
Okay, so so under that circumstances, now I'm getting into confusion. So if you wanted to come here to stay, you would be in the compact and be easier to stay.
To start, it would be easier to start.
And then you would choose to stay, but could still stay in the compact if something better came up in Portland, Oregon or something.
Right.
So it gives you more mobility.
It does.
Okay.
So that nurse who's coming from Texas comes to Vermont,
Right.
has an easy time starting his job,
Yep.
and he decides to stay and changes his place of residence. Then that's when he's required to change his place of residence to Vermont. So then
Yeah.
he would have the Vermont
And then he's
multi-state.
clearly on his own from a cost perspective.
Yeah, right.
Because he's choosing to live here.
Right. And the only way that a nurse has housing and travel covered is usually with these traveling nurses contracts, and that's part of their compensation.
I see.
Because they're coming here for 13 weeks.
Oh,
They
okay.
can't sign a lease and
Yep.
get that.
And that's
all
usually
organized.
when you pay the hiring agency. It's almost like I remember years ago we had temp agencies for secretaries and stuff, and as a hiring manager, we'd pay the company that was hiring the nurse, the secretaries. And
Right.
they
But-
always the agency got a little more than the secretary did.
Yeah, I mean the agencies
Yeah,
they do
covered.
get compensated for
Yep.
that ease.
Right.
But again, that model is not ideal for anybody.
Right.
Many facilities don't want to use that model anymore.
right.
What they really want is to be able to recruit and retain nurses to stay. And a lot of these hospitals are really trying to be aggressive in a recruitment with signing bonuses and retention bonuses and education credits. The state has quite a few programs for educational debt and incentivizing going to nursing school. There's always more that we could be doing there. We should be, in my personal opinion, we should be doing more to support people going into nursing.
I agree with you. Is there a percentage out there of the shortage?
That's a really good
Is there any
question.
number, like are we 20% in the hole? I mean, I don't know if that's even a number that they would, but how short is short?
It's very short. I haven't looked into the statistics recently, but we're at a particularly crucial pain point right now.
So this should really help us.
That's the hope and intention.
Yeah.
We're going to do this as painlessly as possible with this. We're trying to make it an easy process for folks to get licensed in the multi-state and to accept multi-state people coming here. It has some benefits for distinct groups of people. Military spouses is a big one. and one of the reasons why we implemented the compact is it means that people who move a lot, military families in particular, move on average 7 times more than families who are not in the military.
Oh, wow.
Because they're traveling from
Yep,
base to base,
right,
they're getting
right.
redeployed. And the trailing spouse, which is a term I don't love, but a
Yep.
trailing spouse is following their military member.
Yep.
And if you are a teacher, if you're a nurse, you're having to get relicensed in every state that you move to.
Oh, wow.
And there can be significant delays
Yep.
in getting that license. So the compact really streamlines that. So if you are a military
Perfect.
spouse and your husband or wife is redeployed here or to Fort Bragg, then you can just start working in Vermont immediately.
But that applies to everybody, because when I was Commissioner of Personnel for the state, one of our biggest problems is we wanted to hire somebody, I keep picking on Texas, and they want to know what's available for their husband or wife.
Yeah.
And if they happen to be a nurse and in one of these fields, it could be very easy to make that transition.
Well, we
That's
would
a
have
great recruitment tool.
It is. It's useful for everybody.
Yeah,
And I think, the easier it is to move to Vermont,
right.
the better
Yeah,
for
please
everyone.
come.
Yeah.
What about emergency management? Is that part of this training? And
Well-
because EMTs, I don't know if that's part of something that you deal with, but
EMTs are under the Department of Health and are
Okay.
not part of this compact. But emergency management
In
and
the
crisis
hospital.
management is aided by the compact. So because let's say Hurricane Irene happens again and we have a crisis in Vermont that is specific to Vermont, we would be able to bring in nurses from other states, other compact states, to help us with that particular crisis. And at the beginning of COVID, there was some really intentional and powerful legislation around waiving requirements for licensure during the state of emergency and for a period of time after the state of emergency. We're still in that provision and will be until the end of March.
were you here when Irene happened in the department?
I lived in Vermont and I worked for OPR, but I wasn't in this position.
Oh, because I was thinking, I know at motor vehicles, we just waived all interstate compacts with trucks, we waived it. And they could come and go just to help us. I'm assuming they must
Yeah.
have done the same thing during Tropical Storm Irene. It was Tropical Storm Irene.
Yeah.
They must have just waived it to get help up here.
I think we had that provision in statute during a declared state of emergency. And the COVID provisions that were put in place in
Interesting,
March of
same.
2020 were more expansive and allowed for telehealth and allowed for folks who are licensed in other states to come here and work. And they've been very useful and good evidence of future direction for the state when they're contemplating
When you say
licensure.
telehealth was allowed, is there requirements around what can and can't be done by telehealth?
There were pre-COVID, and there will be coming back. And you had to be licensed in the state where the patient was,
Right.
and that is waived right now.
Oh, I see.
So a therapist
Just to get help, period.
to get help.
Right.
So a therapist who's licensed in Oregon can provide care to a Vermont resident without being licensed here right now.
Is this psychiatric help is under this? I was
It's
thinking
all-
in the hospital about the mental health problems in this state are
It's all mental health and physical health.
really, yeah, because I'm going to do a show on mental health because I think we've sort of forgotten to talk about that. And I bet COVID has
And-
brought that up, bubbling up, because it
think it
wasn't good
has.
before COVID.
No.
No.
Yeah, I think mental health is an area where there's a lot of work to be done on multiple fronts and a lot of good people putting intention into it.
So what's left to do for you? I'm sure you don't have much time 4 months isn't quite a long time here.
Right. So we're finalizing all of our forms and our outreach. We have a website related to the compact, and we're working with VCIC, the Vermont Crime Information Center,
Right.
to figure out our process for getting people fingerprinted.
Yeah.
We're making sure that we understand the IT system on the compact IT system, training our staff, getting our staff oriented to the new requirements so that they can competently answer questions.
Are you getting help from the compact itself?
We
are they
are.
sending people here or
We're
just
doing
by
we're doing it all virtually.
telecommunication?
Yeah, we're doing it all virtually, and it's going very well. But there's some system changes. There's some outreach changes. There's
Right.
some staff development changes.
Yeah.
It's really
Is there
actually
anything else that's going to have to go back to the legislature for?
not on the nurse licensure
Oh, good.
compact. Knock on wood.
Yeah, really. Because a lot of times when we start down this path, we're like, whoops.
Right, so there is we wrote into the bill, the legislature wrote into the bill that we will report back to them
Right.
in 2024
Right.
on
Oh, that's
how
good.
we're doing, how many licenses we've had, the fiscal impact of the compact implementation. And so that work is beginning too, so that we're just building our data streams so that we'll have good data to provide
And you must
back.
have rulemaking authority to do all the rulemaking and to
We
go
do.
through the ICAR,
ICAR and
which
LCAR,
means
yes.
what?
The
ICAR.
Interagency Committee on Rules,
Thank you.
and then the Legislative Committee
Yeah.
on
I remember the
rules.
initials, but I don't remember what they stand for.
Yes.
Yeah, and you mentioned ACCD, which is the Agency of Commerce and Community Development, and they're in charge of economic development and getting the word out. And I think this would be a great thing for them to focus on
I
because
agree.
I could see it being a real attraction, especially for the spouse of people coming here for a job at ACCD. And we've had this, I don't know how many times when I was Commissioner of Personnel, you'd have to call around, we'd have to help to get these
Right.
people here. We'd be almost their
Their
hi-
recruiter or
Exactly,
something.
and we'd be calling around trying to see where they could find a job, otherwise they wouldn't be able to come.
Yeah, I mean, most families are built on two
Yeah,
incomes.
for sure,
and,
these days.
yeah, I think it will be helpful. I also think it'll be helpful to hospitals who are trying to recruit, particularly specialty care.
Yeah,
There's a lot of training and expertise that goes into being a med surg nurse or an OB nurse
Right.
or there's so many specialized areas, and there's only so many of those folks trained in the
Yeah.
state of Vermont. So this allows them to expand their recruitment network
that's great.
as well.
So you think we're going to be looking at maybe enticing people to come into this profession?
I hope so. I'm making it my mission to speak about
Good
how
for you.
great nursing is at every opportunity.
Yeah, good.
And I think we're starting to look at other compacts as well to solve
And
this
what
type-
others are out there that would relate to this field?
not to nursing, but
Oh, I
there's a
see. Oh.
psychology compact. There's the beginning of a PT/OT compact. There's the beginning of a counseling compact, a social work compact. So there's
Right.
a lot of compacts brewing, and
Excellent.
it's an exciting time to be part of occupational licensure. And
Well, and I think people would like that. Maybe if I was younger, I would like the flexibility of moving and
It's really-
experiencing the rest of
It's
our nation.
It's really interesting you say that, because when our data showed that young nurses and people towards the end of their career were most interested in the compact
Sure, for sure.
because of that flexibility. It was
Yeah.
the people, middle-aged people who probably
Well,
had
they're
kids
pretty
and
settled, right,
obligations.
right.
They couldn't use those flexibilities, but the young people and the
Well, if
older
I'm
generation.
older, but if I found myself alone, God forbid, but what a great opportunity to
Right.
hit the road.
You can go to Florida for
Yeah.
this winter.
Hello, sign me up. I have it backwards. I go to Maine in the summer and stay here winter. How smart is that?
Maine's pretty wonderful
Oh,
in
it
the
is. It's
summertime.
great. Anytime. It's great. Anyway, we just have a few minutes left, Lauren. Anything else you'd like to wrap up with about?
Well, I just want to reemphasize our fast track endorsement, which applies to all professions, and our telehealth work, which is really, we're putting a lot of brain power into the solutions that are available to expand, and while also making sure that it's safe, telehealth in the state of Vermont.
You doing all of this with your same amount of staff?
Yeah.
Lauren? Well, thank you for that.
We're lean and mean.
Lean and mean, yes,
Yeah.
I know that. Well, we have a great admiration for your boss. We like the Secretary Condos, and he's been on our show a couple of times, and
He's a really wonderful
yeah,
person.
I appreciate all the work he's done for that department, well, agency, I guess. What is it? Secretary of State. What is that?
I always
Who
say
knows?
we're an agency,
Agency.
but I don't think we have that title
No, you
behind
don't.
us.
It's just Secretary of State.
Yeah.
But anyway, so I really appreciate your coming on. It was nice to see you again.
Really nice to see you.
And thank you all for tuning in. We'll see you next week. And in the meantime, keep listening beyond the sound bites.